Excusez-moi, je parle anglais. Thank you. Thank you for having me. This very important and wonderful, very informative conference. I'm going to try to build on the previous speakers and talk more about the importance of cities and urban policy to promote health, and what I call, and many others in the policy arena are calling climate justice, particularly for cities. So most of the action we have seen, maybe unfortunately to date, on climate change has been in cities. Cities are really leading the way, small, medium, and large cities. They are, in my view, the startups, the incubators for the international, hopefully the international policy that we should see very shortly. But on a planet of cities, on an urban planet, we must take cities and the knowledge of urban residents and the health of urban residents as our top priority. We're already seeing the impacts of climate change in cities, particularly on health. And many of the solutions are coming from urban communities. And we need to learn from those solutions that urban policies, city policies, in partnership with non-governmental organizations, civil society, will play an increasingly important role in implementing any international, global, and national agreements. And what I mean by climate justice is that we need what the policy world calls target universalism. And what this is to focus on the most vulnerable populations and places first, and we will then improve the resilience and the health of everyone, of all populations. And I'll give some examples from my own work in partnership with many others around the world, from the US, Brazil, and Kenya. So cities can be good for our health. They ought to be good for many, many reasons that many of you know about: education and employment, religious tolerance, energy and efficiency. Cities are more efficient in many ways, and important in that way for climate action. They also bring together information, knowledge, and important health services, and they have for many years. But within city, inequalities are rising in both rich and poor countries. And this is where we really need to pay attention for effective and health-promoting climate action. So it matters where you live in the city. Here you can see in Sao Paulo, the slum dwellers on your left don't benefit from urban life in the same way that their rich neighbors do. So it matters where you live and how that city is managed. We've heard a little bit about the climate change, urban air pollution and health, or air pollution and health, but there are unequal burdens. Not everyone is equally exposed, as we know, to urban air pollutants. And importantly, the short-lived climate pollutants, the particulate matter with black carbon, methane, ozone, and others are disproportionately burdening the poor and in some communities. And this is contributing, as the WHO has recently released an important report, to a range of health problems: heart disease, stroke, respiratory diseases, low birth weight, cognitive development. So a range of health outcomes that we're seeing disproportionately exposed in cities. And the poor, again, are disproportionately impacted. We heard before from indoor air pollution, cook stoves, outdoor burning, lack of municipal services forces people to burn trash, and poor transport policy. All of these things, again, killing more people, or as many people as tobacco. But again, the burdens are unequal. These are some recent data from Nairobi. We'll talk some more about this in some more depth in a moment. But we can see on your far left that no matter the measure of mortality in this case, the informal settlements or slums in Nairobi face a greater mortality burden than living in the city or those living in more rural areas. We see the same thing in India. Here's from Mumbai. This is particulate matter measures across the city and in one particular slum or informal settlement. But the reality is we have very little good within city data. We see lots of global climate models. We see lots of national information. But if we're going to take action and improve health and resilience of urban populations, we need good within city data. and we need explicit policies that address the burdens and risks of the poor. And they continue some which we heard earlier, increased severe weather and flooding. This is again in Brazil on your left, and in Kenya on your right. And importantly, the gender dimension to climate risks can't be ignored if we're going to promote climate justice, that women are already disproportionately burdened and will continue to be, as we saw from the earlier presentations, of heat events, water scarcity, food insecurity, water, fuel dynamics, and home health care burdens fall disproportionately on women. And climate justice makes gender a central component and gender equity a central component, not an afterthought. So what's the framework, what's the health framework that we're using to try to address these multiple hazards? We call it addressing multiple toxic stressors. And we've heard about many of these stressors on the human body, from risks of heat and flood, food insecurity, air pollution, lack of transport access, threats of housing displacement from severe weather events, racism and social exclusion, lack of services, violence, and forced informal labor. The biology and epidemiology of multiple stressors is quite clear. And instead of just focusing on one exposure, the work that we've been doing is trying to focus on these multiple toxic exposures, and I'll explain it briefly. In a stressful situation, we have a hormonal release, cortisol, adrenaline. It's that fight or flight mechanism, and it should be healthy for us. That our immune system gets hyperactivated, and then through that hormonal release is supposed to shut off during a stressful event. But in communities and with populations with these multiple hazards, that hormonal release becomes toxic because it doesn't shut off. It continues and continues until it begins to wear away at the body's immune system. This is the concept of toxic stress. And it's contributing to a rise in many chronic illnesses across rich and poor countries. And again, disproportionately burdening the urban poor. This is not just about mental health. This is a biologic change in the immune system and even impacting telomeres, our chromosomes, which can shorten our life. So a range of health impacts biologically embodied inside our body from these multiple environmental stressors in communities. So what are we trying to do about this? First example of a regional network of climate action and health equity in the San Francisco area in the US. I'm going to talk primarily about the city of Richmond, which is right near San Francisco, and in Oakland. It's a city that has very high rates of poverty. A majority of the population are immigrants, high unemployment when we first started, and is home to one of the largest petrochemical refineries in the western part of the United States, which emits a tremendous amount of pollution. One of the first things we did was to try to understand the health burdens in this region and how were they spatially distributed. We began mapping all health outcomes with our partners. So I'll just go through this quickly. This is cancer, heart disease, childhood asthma. You can see the same region of the same city in the region has the highest burdens of all of these illnesses, and then finally life expectancy. So with only a few kilometers away, we see a 15-year difference in life expectancy. Many of you have probably seen the same map for the metro here in Paris or in London. Many cities in the world, we see the similar spatial dynamic to environmental burdens. So how can urban policy and planning begin to address these spatial inequalities? We started in Richmond by trying to integrate health equity into the land use and spatial planning, and have now adopted something called Health in All Policies, which is really trying to integrate health equity into all urban decision making. We began, though, with engaging with residents, with NGOs and community organizations and civil society who were already concerned and knowledgeable about these multiple stressors in their community. We developed healthy action plans, community-based research in partnership with cities, NGOs, and universities, and really trying to bring together the different sectors who at this point had not been working together. We had environment over here, health over there, transport, planning, etc. No one was talking to each other or working together. And that's the concept between the health and all policies. A climate justice plan that really tries to integrate actions of multiple sectors. So we were able, over the last couple of years, to be the first city in the United States, in Richmond, to pass a health and all policies law, which mandates that every policy have a health impact assessment review, that we link the city's budget and its performance standards to health equity measures. We also recognized that there was more than just environmental or physical environmental issues. Social inequalities, poverty, street-level violence was a major stressor. So we integrated those aspects as well into the Health and All Policies plan, in addition to trying to, and we successfully sued the Chevron petrochemical refinery to reduce its pollution and provide a $90 million community benefit agreement to the city to address climate and health issues. Some of the early outcomes, this work has been going on now for about 6 or 7 years, were for community residents to redesign parks in a way that they could use them, make them safe and usable. This employed local residents who were unemployed and allowed people to really express their culture and their identity. We developed a training program in photovoltaic solar installation and actually started to install those PV panels onto people's homes at low or no cost. We engaged in many transport changes in bicycle and pedestrian improvements, food security projects, and again, reducing air pollution. So this health and all policies and climate action strategy has also benefited from the state of California, which has a cap and trade program, a law to reduce carbon emissions from industry primarily. Now, a percentage of that, the fees from that trading, from that cap and trade, must go to vulnerable communities. But each vulnerable community needs to have a plan of action. So Richmond has benefited from having this community-generated plan to receive some of those funds. So some of the outcomes that we're measuring, and we're continuing to monitor this, are violence reduction, solar energy installation and reduction of people's energy bills, reduction in PM 2.5 pollution and hazardous air pollutants, reductions in unemployment rate by employing young people again in energy efficiency and many of those park and physical improvement programs, building new affordable housing, and the savings that the city has received from implementing many of these health and all policy programs. Second example comes from Brazil, in Rio, again, where interesting and important national policy and city policies have stressed climate resilience and adaptation and sustainability, but really not reaching every community, particularly poor communities. This is a partnership between Berkeley, Fiocruz, and UERJ, and the Center for Health Promotion, which is an NGO in Rio. And the government of Brazil recently announced that it's a key priority in its national action plan for COP21 is to address the impacts of vulnerable communities. But understanding those impacts and how they get played out on the ground is really what we've tried to do with our partners. One of the programs is called Plataformas de Centros Urbanos, which is really an integrated urban strategy, again, much like in Richmond, focusing on housing security and infrastructure, preventing displacement and gentrification, employing local residents as promotoras or health promoters to really bring their knowledge. Many of these are almost entirely all women who bring their knowledge of health issues to the community and bring those back into policy and planning decision-making. And this really tries to implement the Brazilian and Rio's Resilience and National Climate Action Plan. One of the projects is young people, students mapping their community to understand What are the hazards they face? This is just one example of mapping landslide areas, inadequate sanitation, the presence of rats in open water. We know increased dengue, leptospirosis, and other vector diseases, and unsafe transport or sanitation, mobility within the community. And these maps and this information moves from one community into a citywide network. This is a map of the Rio Healthy Cities Network, and the idea is that one community can't really be successful alone. They need to share resources, they need to share expertise, and build political power across a city and across a region, much like in the San Francisco case. One of the implementing actions in Rio is something called the PUSOs, or the Urban and Social Guidance Centers. These are a one-stop location where it builds from a health clinic to include things around infrastructure, housing, mobility, and a whole host of other both environmental and clinical services in one location in a community, including things like food security. So the idea, again, is really to integrate multiple hazards, learn from community residents what they know about those hazards, and have community-specific implementation and strategies that relate to, in this case, the citywide and national climate action plans. Third and final example from Nairobi, and this again is a partnership with universities, local government, and a host of NGOs in Kenya. I'm going to focus on our work in a place called the Mathare Valley, and you can see it here on the map. We're also working in many other informal settlements, Kibera and many others you may have heard about. Again, in Africa in particular, the majority of the populations are living in informal settlements. So if we are going to take urban climate action or climate action seriously, we need to understand cities and the informal communities in these cities. The strategy that our partners have used is to really build an evidence base. These are communities that often don't exist on official maps. There's very little official data, particularly population and environmental information. So one of our first tasks is to really mobilize the community and gather quality data, physically survey and map. And that, again, builds into these networks of slum dweller organizations, and this is a national network called Muungano that works across all of Kenya. This is a very participatory process where residents come together and share their knowledge. We train them to do door-to-door surveying, to do physical collection of data, air sampling, water sampling, etc. We've also we ensure that this isn't just information that stays in academic circles, but to try to move it into the media. This is an article from the UK Guardian, and to raise awareness, to put political pressure on decision makers. That information that we gathered, and I'll give some concrete examples in a second, we developed into something called the Mathare Zonal Plan with our partners, which was the first region-wide slum upgrading strategy in Nairobi that really took an integrated approach. We didn't prioritize climate change, but we prioritized health and the basic needs of the community, which also addressed their climate vulnerability. We were able, through these data, to show differences between informal settlements in Kenya in terms of some disease outcomes, so that not all slums, not all communities, we assume, have similar burdens. And this is important when we think about resilience and adaptation. Housing is a key issue. It's typical housing in Mathare with tin roofs, dirt floors, etc. So one of our first strategies was using the mobilization to do housing upgrading, which you can see on the here, and many of these are self-built. People live in the house while they build it, and they can go up 3 or 4 floors. Water, again, we know water insecurity, who controls water access, water contamination, serious environmental issue that's only going to be more challenging with climate change. We were able to map the distribution of water points. And we can see this is the map on the top left is where our water access. But water access is often controlled by a gang or a cartel. It's not easy to get access to. The price fluctuates. We're also able to map and plot here. This bar chart is showing all of the 13 villages within Mathare and the number of people per functioning water point, which ranges from almost 2,000 to 200 or 300. That's per people per water point. And again, not all of these are accessible 24 hours a day. And the red line there is the SPHERE, the International Emergencies Humanitarian Standard. So on a chronic basis, we're exceeding the humanitarian standards of water access. But we moved beyond just academic and environmental analysis to how do we move this into action. Working with students and architects and engineers, we're able to move from a situation where the water pipes are just exposed and contaminated on the surface to a design where the road is tarmacked, is covered with drainage, to household piped water connections with meters that now look like this, where you have a water tap that you or I would expect in your home. And this is now a model for upgrading across all of Kenya, in fact, and in informal settlements, financed by the water company. They recognize that these are hundreds of thousands of customers who are already paying high rates for water. So they are willing to invest to make this work and work well. Toilets and latrines, very serious issue of environmental injustice and inequality, especially for women facing sexual violence, as well as environmental contamination in places like Mathare. Again, we're able to map the distribution, the inequitable distribution, and these data were important, not just to understand the inequality, but to advocate and move for change. We're able to get media coverage globally about this issue, particularly the issue of relating infrastructure, sexual violence against women, and the need for secure and safe sanitation. And this is an ongoing struggle. In fact, women are still organizing and protesting for the government to make change, but we have seen some government and World Bank funded investment in new sanitation. Flooding, mobility, another serious challenge in this community, and you can see this is the dry season on the left, but these rivers flood these homes. And this was not a concern or an issue in Kenya's climate action plan, but after we were able to make this issue visible, again, through our mapping of showing the flooding during the rainy season and major rain events, the number of people impacted, the number of structures, toilets, etc., really putting the human face, as the speaker before just mentioned, behind the changes, the environmental changes from climate change on people's health and well-being in this community. And again, we've tried to move from this displacement from flooding to a design that the community endorsed to prevent the health impacts. Energy change. We saw the air pollution before, particulate matter, carbon from burning charcoal, still very widely used. We're working with partners to try to change the cook stoves and also access to electricity. This on your right, you see a electric box, a junction for formal electricity connections to come into the community, which only about 20 to 25% of the community have. Finally, a major issue is food insecurity and how it relates to poverty and impacts health. Again, through our data collection, we're able to try to understand this in much more detail. And we found, to our surprise and to many of our partners' surprise, that food was the highest cost people paid. This is in Kenyan shillings per month expenditures, more than things like rent that people were paying more than health care. We also understood how this had a cascading effect on women's lives in particular of food insecurity. That people had skipped meal size, women had sold sex for food, they had not taken their antiretroviral drugs, for example, because of lack of food. and there were a whole cascading set of effects. And so we're working with many women entrepreneurs and food vendors to organize a food cooperative which shares in pricing and accessing food, and much of the food is street food that's cooked for residents, and to also help incubate small businesses to improve economic security. And in fact, in Nairobi and in Kenya, the informal sector represents a tremendous amount of GDP. So without addressing the economic situation, particularly of women in the informal sector, the country's economy will continue to suffer. And this needs to be a key issue that's considered in climate resilience and climate change. And importantly, we don't want to just focus on community scale change, but how do we move this into policy? The data, the evidence, the actions act again as startups, as experiments to learn from, to move to national policy and urban-wide policy. And just recently, or this past year, the President of Kenya launched a major upgrading in Mathare and 2 other informal settlements. You can see him here wearing his Made in Mathare, Nairobi green t-shirt. And there are still many, many challenges left to implement this work. But we're starting to see some positive impacts from this work and many others in Nairobi's informal settlements in terms of health outcomes and those basic services, access to water and a dignified toilet. And again, the strategy is not one exposure, not one health outcome, and not one health behavior, but really this integrated health in all policy strategy. Here I'm showing the World Health Organization's recent Health in All Policies guidance on how to think across sectors and integrate these issues. So what is urban climate justice? How do we move towards urban climate justice and think about cities as drivers and leaders in the change we need to address climate change and health? That urban communities and making them healthy and equitable ought to be our goal, with climate mitigation and adaptation as the co-benefit. Changing the conversation from health first, climate adaptation as a co-benefit. This can only happen by co-producing evidence and expertise, policy-relevant knowledge from scientists, society, and policymakers. And policy still really matters. Local community action needs to be scaled up and shared and learned from across communities, and urban and national policy and international guidance is critically important to make this happen. But we need to take an adaptive approach. This is not going to be science as usual. We're not going to have the answers and try to convince policymakers that the science gives us answers on what to do in all cases and for all issues. We need to take action now, recognize that there is going to be ongoing uncertainty, both scientific and health outcomes, but monitor what we're doing. The monitoring should feed back into learning and adjust what we're doing over time to ensure that the most vulnerable places and populations health improve and their climate resilience is secured. Thank you very much.
Thanks for this very rich and optimistic presentation. Si vous avez des questions, est-ce que vous pouvez juste essayer de les poser en anglais si c'est possible?
Yeah, thank you, Professor CORBURN, for this very interesting presentation. I'm Dr. Georges Saline. I work for the city of Paris, and Bernard Jaumier, the deputy mayor, mentioned during his introduction that the city of Paris is going to implement an environment and health action plan. And the overarching goal of this plan is to reduce environmental health inequalities in Paris. So we are very interested in your concept of health in all policies for climate justice. And I wanted to ask you, in your experience, have you identified key drivers or motivators for all the policymakers and departments that are not directly in charge of health and environment, in order for them to do more than pay a lip service to this goal. Thank you.
Very good question. How do we get non-health actors and sectors to take an interest in health action and health equity? It's not easy. What we have tried to do is first to educate them on what are the drivers of health inequalities. Many still think that it's only access to health care, or it's not their job. It's something that happens in hospital or clinic. And to bring an environmental health perspective into every sector, from transport, parks, libraries, schools, and show where they can have an impact on health inequalities. And that took us 2 or 3 years to move in that direction. Using the toxic stressor framework, which really resonated with residents, that they realize in their daily life, it's not just that they're impoverished or that they have a 2-hour commute on the train to get to a job that doesn't afford them enough food, or that they're fearful in their neighborhood of violence. There are multiple things that are happening at the same time. So how can we help understand the multiple cumulative impacts of these environmental and social stressors? That framework has helped us move that conversation forward with non-health actors, and also with community residents and civil society as well. And the third thing is that really getting reform within the health sector, the health care and health community, that they see new ways of communicating what they do outside of just clinical care and health care, that they begin to partner with transport decision makers or urban planners, people concerned with housing, immigration, violence reduction, etc. And finding new ways of bringing them together has been important. And we've done that primarily around actionable research, and then talking about the results of that research for policy. So it's really trying to make it very concrete and practical. But again, it's not easy, but we tried to use multiple strategies to do that, and it happens over time.
Thank you. I'm Charlotte Marchandise. I'm Deputy Mayor of Rennes and political chair of the French Healthy City Network. So we've been working on the health in all policy advocacy for all people, and we're actually working on at the network which Paris belongs to, on going more with the other deputy mayor and finding advocacy. So what we get here is really strong to go on and convince the other mayors that we have to work together. And one of the things is also getting up this advocacy at national level. On the law on health is going back on the National Assembly today. So with the other Society of Public Health in France, we are making today a big article on the promotion of health and resilient environment. And we're going to tweet it a lot this afternoon, so it's more a call. So if we believe in that, let's please help us. And the third thing was we are thinking about translating Ilona Kickbush's work on health in all policies with the WHO in France and adapt it to the French government and all the issues we have. So it's also a call that if we can work together and make it together, we'll do it better. Thanks.